I'm Adrian Plunkett. I'm an intensive care consultant at Birmingham Children's Hospital. The idea for Learning from Excellence came about from my own experiences where I was a patient and spent some time in hospital and realised that a lot of the care I was receiving was really excellent. And as I recovered and went home and got back to health, I realised that there must be something we can learn from those episodes of excellence. So the idea sort of came about from that experience. But then also when I was at work, I was involved in, and have been, continued to be involved with investigating patient safety episodes where things have gone wrong. And I realised, although that's very useful and laudable, we're only looking at a very small part of our system when we do that. And I came to realise over time that we could potentially learn from what's going right as well. So when we created Learning from Excellence, we wanted to create something that was very similar to adverse incident reporting, because everyone in our institution, certainly in our department, is very used to the concept of reporting adverse incidents. We have a high reporting rate. So we created a very simple online reporting system for reporting excellent practice. We didn't define what excellence was. We said if you see something excellent in your own definition, you can just report it. So what we've created is a formal positive feedback reporting system for peers to report one another in healthcare. So when I started thinking about Learning from Excellence after it had been up and running for a few weeks, I got down on paper what I thought this whole thing was about. And I realised what I was writing was a philosophy. It wasn't just a standard operating procedure or a list of rules. This was actually what I deeply thought about the purpose of the initiative, and it came down to two things. The first thing is we're trying to understand a new part of our system for the purposes of improving quality. So we're looking at something new we're not normally looking at. Normally we look at what goes wrong or how we can prevent an error or harm happening. With Learning from Excellence, we're looking at a totally new part of the system where things are going really well, and the purpose of that is to make things better for the future. So we're trying to improve quality. The second thing we're trying to do is to improve the morale of staff, because we've created a formal system for providing positive feedback to one another. And that is our philosophy in a nutshell. Well, when we first started trying to analyse our reports and get to understand them in more detail, we took the root cause analysis approach. And we realised that didn't work perfectly for what we wanted to do. Although it was interesting, it gave us answers, it is by definition a very focused look, and it comes up with a single answer. We wanted something that was more expansive and more creative, and something that was able to get staff members to really think about what else we could do, not what went wrong or what was the root cause of something, but what else we could do in the future. So it's very forward-looking. And we came across something called Appreciative Inquiry, which is basically a structured dialogue which allows you to do that. And then initially we started reading about it and just started practicing it. And then we've met Appreciative Inquiry practitioners along the way. So
I'm Emma Plunkett. I'm a consultant anaesthetist at University Hospital Birmingham. I also work at Birmingham Women's Hospital, and I've been involved in introducing Learning from Excellence within theatres and anaesthetics at UHB, and it's also now started at Birmingham Women's Hospital. So the three reasons I would give for us winning the award are: Learning from Excellence is a really novel initiative within the NHS, and it was started 3 years ago at Birmingham Children's Hospital, and that was the first place that has introduced it. And it's an initiative that's been conceived, developed, implemented by frontline staff. It's embracing a new concept in patient safety, which is this concept of safety too, and learning from when things go right, which previously we haven't really done in healthcare at all. The second reason I think we should win is that this is a demonstration of how the Academic Health Science Network and the Patient Safety Collaborative in particular works well. So they've engaged with frontline clinicians who are doing a project and making it work, and allowed them to expand it across the region and actually nationally and internationally in this case. And they've linked us with an external organisation that it would have been very difficult for us to find and to link with, and given us some funding to be able to train staff and educate them about the initiative and the practical ways it can work. And the third reason I think we should win is because of the initiative itself. So it has two broad aims. The first aim is to show appreciation for all the excellent work that is done in the NHS every day. We know that staff morale is probably at its lowest in the NHS at the moment, and when staff feel undervalued, then they just can't perform to the best of their ability. So if you appreciate and acknowledge all the good work that's done, it will lead to better patient care. So that's the first purpose for learning from excellence. The second aim is that because of what it does, it looks at when things go well and enables us to learn from those episodes. It's a way of improving the quality of care. So by studying examples for when things work well, we can make more of that good work happen in the future, and that leads to better patient care. I think it opens up the conversation around how we perform at work. So we have this system for where we look at when things go wrong. I think sometimes people feel a bit worried about talking about when things go wrong. And actually by balancing that with looking at when things go well, people start to open up and to talk more about their practice generally. And I think you can link examples of when things have gone well to when things haven't gone so well, and actually use the learning from looking at positive incidents to actually address when things haven't gone so well.